Good afternoon, and welcome to the first session of our Kids and COVID conversation series. I'm Bruce Leslie, president of First Focus on Children, and I'm so grateful to have you all here with us today as we reflect on the impacts of the pandemic on children over the past 2 years. When the coronavirus outbreak first began, there was a false narrative that the virus didn't impact children. We know that this is not true from a health perspective. 12.8 million children have contracted COVID-19. Over 100,000 children with confirmed cases of COVID-19 have been hospitalized, and nearly 1,500 children have died with COVID. And we are still learning the long-term impact of the virus. We also know that the idea that kids are immune to COVID is wrong from a social perspective. Every aspect of the lives of children were negatively impacted by this global pandemic. We know that the obstacles children face existed before the pandemic, but the past 2 years have intensified these issues and deepened disparities across racial and socioeconomic lines. We must be honest about the impact of the pandemic on children in all aspects of their lives, as well as the lessons learned over the past 2 years in order to create true progress for children. Children are not simply small adults. They are a vulnerable population with a unique set of issues. Some of the solutions to their problems will mirror the response seen for adults, but others, the quality of children, demand a unique policy perspective and approach. Over the next 6 weeks, each of our conversations will focus on a different impact of the pandemic. We'll hear directly from community advocates, policy experts, and members of Congress on the experiences of children over the past 2 years, the current state, and the potential policy solutions. We hope that you will join us throughout the series. Children deserve our support. It's time that we come together and do what's best for kids. You can register for upcoming sessions on the First Focus website, www.firstfocus.org, using the link on the screen and in the chat. Today, we are here to talk about the specific impact of COVID on the mental health of children and youth. If you want to join the conversation on Twitter, please use the hashtags kids and COVID, and it's a kids issue. There's been, and hashtag it's a kids issue. There has been a lot of interest by the administration and Congress on this issue. In December 2021, the U.S. Surgeon General issued an advisory on mental health. In February, between the House and Senate, 5 hearings were held to discuss the mental health crisis for children and teens. House and Senate committees have vowed to craft a mental health legislative package for children and youth this year. Recently, President Biden highlighted the mental health crisis in his State of the Union address, and he outlined several priorities in mental health with an emphasis on providing more services to children in schools. As we dive into this topic today, it's important to note that the crisis in mental health isn't new, but the pandemic has made things much worse. We begin today with a conversation of children and youth mental health. We have an expert panel that I'll briefly introduce, but you'll have more introductions on that shortly. Avery Pakulis and Elaine Dalpiez from First Focus on Children. We have Trace Terrell, a youth activist from Oregon. Miriam Calderon, who's the Chief Policy Officer from 0 to 3, and I'll just take a point of personal note to say she's one of the smartest people I know, and she could basically speak on every single webinar that we have throughout this series. She is an expert on kids, on every single topic, and just a complete rock star in the child advocacy space. Dr. Sharon Hoover, who's the co-director of school mental health at the University of Maryland, and Scott Hutchins, who's the mental health and Medicaid coordinator at the Michigan Department of Education. But first, I would like to introduce another champion for children and longtime advocate for children's mental health, Senator Tina Smith of Minnesota. Senator Smith is leading the way on children's mental health by bringing awareness to this issue, and she has sponsored key legislation to address this issue. In particular, her Mental Health Services for Students Act would strengthen school-based mental health services for students in K through 12, 12th grade, by providing training to school personnel on how to recognize, assist, and refer students who may need services. It would also help schools partner with local mental health service providers. We are grateful for Senator Smith's continued commitment to children and are glad to have her with us today to open the conversation. Senator Smith.
Hi, I'm U.S. Senator Tina Smith. Thank you to First Focus on Children for your work to advance the mental health of children. You know, even before the pandemic, there was a stark need for mental health services for youth. And the past few years of remote learning and isolation have brought a new urgency to this epidemic. Due to the pandemic, many children and young adults experienced serious interruptions to in-person school and missed time with friends and relatives. We've made significant progress, and today almost all students are now back in person, but we still have lots of work ahead to help young people get back on their feet. We need to treat mental health with the same urgency and attention that we treat physical health. And this means ensuring that every young person has access to the mental health care that they need. Around 1 in 5 kids lives with a mental health related challenge, which is about the same proportion as adults. Yet children and young adults often have a far more difficult time getting mental health care support. This is why I introduced the Mental Health Services for Students Act, which would help schools provide on-site mental health services for students and allow us to reach children where they are. We also need to prioritize investments in early child care and education, which are important for identifying mental health issues earlier. In the Senate, I'm working to help kids get the mental health care they need so that no child has to go without quality, affordable, and culturally competent mental health support. So thank you for all that you're doing, all of your hard work and advocacy on this issue. And I look forward to working with all of you to protect and support the health and safety of our children. Thank you, and I hope you have a productive panel.
Thank you, Senator Smith, for your words of support, and we look forward to working with you and your colleagues in the Senate as you attempt to move your legislation forward and to craft a comprehensive mental health package this year. And now I'll turn things over to Avery Pukulis.
Avery, you're on mute.
I was doing so well, Tim, too. Thank you. Thanks, Bruce. Hi, everyone. Welcome, and thanks for joining us today for the incredible panel of speakers we have lined up. If you're watching on our closed door session, you can submit a question for our Q&A portion of the panel using the comment question and answer tab on your right, the right side of your screen. And if you're tuning in on our website, Bruce mentioned this already, or one of our social media channels, you can participate in the live conversation by using the hashtag #KidsAndCovid on Twitter. You can post your tweets with that hashtag to submit a question to the panelists or to keep the conversation going for your own network. I now have the honor of introducing our first panelist, Trace Terrell. Trace is a 17-year-old senior in high school from Lapine, Oregon. He has volunteered with Youthline, which is a free, confidential teen-to-teen crisis line, for 4 years. As someone with lived experience, Trace shares his story and what he's heard from teens across the country to change the narrative around youth mental health on the local, state, and federal levels. Trace may look familiar to some of you. Unlike most of the rest of us, Trace recently testified before Congress in the Senate Finance Committee on one of their 2 youth mental health hearings. He did an incredible job that day, and we are just thrilled to have him here with us today. Trace, I'll turn it over to you.
Thank you, First Focus on Children, for the opportunity to present here today and for the introduction. My name is Trace Terrell. I use he, him pronouns, and I'm a 17-year-old from Oregon. Before I share more about myself, I would first like to tell you some things I have heard from teens across the country. 4:07 p.m. I just need someone to talk to. 4:37 p.m. My dad hit me, but you can't call the cops. 5:23 p.m. I need therapy, but my family can't afford it. 6:28 p.m. I just failed my math test. 8:07 p.m. I just lost my dad and I can't stop crying. 6:42 p.m. I want to kill myself. These are just some examples of the many conversations that I respond to as a volunteer with Youthline, a free, confidential teen-to-teen crisis help support hotline located in Oregon. Whether helping someone navigate complicated feelings about their sexuality or working with others to develop comprehensive safety plans, I spend 3.5 hours every week responding to a variety of mental health challenges experienced by teens across the country, with an emphasis on the fact that no problem is ever too big or too small. I became involved with Youthline during my freshman year of high school. As someone who struggled with depression, suicidal ideation, eating disorder behavior, and anxiety throughout middle and early high school, I, for the longest time, believed that no one could relate to my experiences. However, as I became more involved, I began to see my challenges reflected in those who contacted the line. Whether it was the shared experience of wishing to wake up straight or the common struggle of access to care, I realized that my challenges were a microcosm of public health issues that affected hundreds of thousands of teens across the country. As more and more teens start to have conversations about mental health and engage in help seeking behaviors, the need for expansive and intersectional mental health efforts has never been so needed. Since Youthline's inception, we have experienced an annual increase in contact volume of about 15% annually, with an additional increase of 3 to 5% since the start of the COVID-19 pandemic. So, what can we do to address the youth mental health crisis? From a youth perspective, one of the most practical steps we could take would be to centralize our mental health efforts in schools. We should also address the pressing challenges that young people continue to face in accessing mental health care, like broadband access, transportation availability, and excessive cost. It is also incredibly important to invite youth to the table and value their insights as natural partners in this work. In all of this, I think the biggest theme is bringing care to where people are. What we saw and continue to see with the COVID-19 pandemic is an increase in telehealth and other remote delivery options. Because the COVID-19 pandemic has exacerbated already existing mental health challenges for so many people, it is so important that mental health care is easily and readily accessible. And for teens, that's having access to care on an electronic device, which is part of the reason why Youthline works so well, as teens can call, text, chat, or email. Another reason that Youthline works so well is that it is teen to teen. We know that peer-to-peer support works because statistics show that teens are more likely to turn to each other before anyone else. We also know that there is a substantial need for it. Almost 360,000 people under the age of 25 reach out for help every year to the National Suicide Prevention Line. When peer-to-peer support is available, teens will use it. To further encourage help-seeking behaviors and build on existing programs, it is essential that we expand the peer-to-peer support model across the country. One example of this would be by funding a national youth line, with the focus of it being crisis help support instead of crisis intervention. Youthline's core ideology is that no problem is ever too big or too small. And when we provide resources that promote this upstream and holistic approach, we equip teens with the coping skills needed to address other adversities and challenges later in life. At Youthline, we know that what we do makes a difference in the lives of young people across the country. And we know that because of what we hear from teens after we've connected them to help, after we've talked about self-care, and after we've helped them find a path forward. 6:26 p.m. I feel so much better talking. 7:34 p.m. There's no one else in my life I could have talked to. 8:34 p.m. If it weren't for this conversation, I wouldn't be here today. Thank you.
Trace, thank you so much. It's really important to us at First Focus that we include a youth voice in the issues that we're talking about, and yours is an incredible voice. So thank you for joining us today. I now have the privilege of introducing our next speaker, Miriam Calderon. Miriam is the Chief Policy Officer at 0 to 3. She has served under the Biden administration at the U.S. Department of Education, as well as in the Obama administration at the White House and Department of Health and Human Services, advising on early learning policy. Miriam was appointed by Governor Kate Brown of Oregon to serve as early learning system director for the state, where she oversaw the implementation of the largest expansion of early childhood investments for young children and families in the state's history. She's also served at the BAM Family Foundation, the BUILD Initiative, District of Columbia Public Schools, and Unidos. Miriam began her career in early childhood as a mental health consultant in Head Start programs, and we are so lucky to have her here with us today to share her expertise in early childhood. Miriam, please go ahead.
Thank you so much, Avery. I just have to say also thank you to Trace. That was just really powerful, especially as a mom of teens and some lived experience. I really appreciate your words today. So I also want to thank Bruce for that lovely intro and definitely manage expectations here and first focus on children for including me in this important conversation. I'm really thrilled to be here and to be able to really bring the perspective of babies and toddlers as we think about this issue of mental health and the adverse conditions and how we've exacerbated challenges as a result of the pandemic. So I want to really kind of emphasize 3 points today. One is that babies and toddlers can absolutely experience adverse mental health um, uh, conditions and experiences and have challenges, and that the global pandemic has intensified the kinds of adversity and the conditions that we know result in mental health challenges for young children. The second point is really that our nation's mental health system really lacks the capacity to address the mental health needs of babies and toddlers. And we need to be a lot more explicit about the mental health capacity and the strategies that are going to get us there, particularly in being able to integrate mental health into all the other systems that see young children and families. And then finally, that there is as we think about solutions, we have to think explicitly again about mental health system capacity and integration and alignment with other systems of care. But there is also the solution also lies in a much broader policy agenda. I think the senator really touched on that, thinking about economic and racial justice, policies like that we have been talking about in this administration, the Biden administration has put forward child tax credit, paid leave, quality childcare, healthcare and wellness for families and the adults and babies' lives. This all matters as part of a prevention and a mental health promotion strategy, and we need this especially at this time. So first, the mental health challenges for babies. We often, there's a enormous amount of science that tells us about how critical the first years of a child's life is. The science of brain development tells us that this is the time in human development when the foundation is set for future health, for social emotional wellness, for success in school, physical development, and that foundation is set, and healthy development really is centered in the stability, the safety, and the nurturing relationships and environments that babies are experiencing. So really the nurturing relationships and environments are the ideal conditions for healthy brain development. While we know then that this is, from a brain science perspective, a period of enormous opportunity, we also know it's a period of extreme vulnerability if these optimal conditions for healthy development are not there and in place. So when young children are living in families, are babies and toddlers with high levels of stress, parental loss, substance abuse, mental illness, exposure to trauma, or violence, they are at a higher risk of developing adverse mental health. The stressors of poverty, we know, also multiply and intensify these risks. We know that these are also interconnected as well with racism, racial justice. So again, that piece between economic and racial justice is critical here. The research tells us that young children experience mental health issues at roughly the same rate as older children, ranging from about 10 to 16%. So that's anywhere between 1 million to 1.8 million infants and toddlers experiencing some sort of mental health issue. As we've looked to understand the impacts of the pandemic, first and foremost, we know these issues that we know are the stressors of families, the stress that families are under, are going to exacerbate mental health issues for babies and toddlers. We've also been fortunate at 0 to 3 to have a partnership with an initiative called Rapid EC. I can put a link in the chat, but this has been an ongoing nationally representative survey of families since the pandemic began. And that data is clearly showing us that the material hardship, the social isolation, increased emotional distress among parents is taking place, and that is having an effect on their young children, and that these distresses, these patterns of distress, have remained elevated throughout 2021 and the pandemic. From a mental health system capacity perspective, we need to think about a couple of things here as we work toward solutions. One is, how do we ensure that the mental health system is better integrated into under other systems of care? So the early intervention system, our pediatric primary care, the child welfare system, our early care and education system need to be better integrated with mental health. The professionals and the family supports available through those systems need to be able to access and connect to mental health, and mental health supports need to be better integrated into those systems. And we need to be able to think about the mental health system capacity specifically at getting better at diagnosis and developmentally appropriate treatment for babies in the mental health system. And then finally, again, this broader policy agenda of supports really needs to center infant early childhood mental health, is aligned with infant early childhood mental health prevention and promotion. So what we do to support families to have what they need to provide stable, secure, nurturing relationships and environment for their young children matters. And we need to think about that as part of this work. And then finally, I'll say that we need to also normalize infant early childhood mental health. So it is not widely seen or recognized. It's actually very difficult to talk about, right? We don't often want to think about babies having mental health issues, and certainly attaching any kind of stigma around diagnoses or treatment. And so these are really sensitive subjects, but at the same time, babies cannot articulate for themselves what they are experiencing. And so this really requires all of us to really think about surveillance and normalizing and talking about these issues. And hopefully COVID has given us more of an opportunity to be able to elevate this important dialogue, and, of what we need to do to better support the mental health of our babies and toddlers in our country. So thank you so much. Look forward to any kind of further questions and discussion.
All right. Thank you, Miriam. We really appreciate your perspective on early childhood, and we look forward to diving deeper on this topic today and in the weeks and months to come. My name is Elaine Dalpiez. I now have the pleasure of introducing Dr. Sharon Hoover. She's a licensed clinical psychologist and a professor at the University of Maryland School of Medicine in the Division of Child and Adolescent Psychiatry. Sharon is also the co-director of the National Center for School Mental Health, where she leads national efforts to support states and schools in the adoption of national performance standards for comprehensive school mental health systems. Since the onset of COVID-19, Sharon has worked with education and mental health leaders across the country to support educators, students, and their families with social, emotional, and academic needs. Recently, Sharon helped to co-author a report for the Hopeful Futures campaign, which is titled America's School Mental Health Report Card, which I think she'll put the information in the chat for you. And she'll talk more about this new report today. So welcome, Sharon.
Thank you so much, Elaine, and thank you to First Focus on Children for inviting me into the conversation, and also to the speakers before me, Trace and Miriam, for lifting up the issues of youth leadership and peer-to-peer support in promoting youth mental health, and also lifting up the issue of infant and early childhood mental health. I know I work primarily in the K through 12 child and adolescent space, but I always argue that we shouldn't be having this conversation without also thinking about and attending to our littlest members, our infants and our early childhood, or our toddlers. So thank you for bringing that to light, Miriam. I did have the privilege of testifying alongside Trace a couple of weeks ago during the recent Senate hearing on mental health, and was certainly both moved and inspired by his action. So I'm grateful to First Focus on Children for bringing youth voice and leadership into the conversation. So I've been asked just to speak for a couple of minutes about the role of schools in supporting youth mental health. And we've always argued, and certainly now more than ever, that schools must be considered a critical component of our system of care and our safety net, really, as we put measures in place always, but certainly right now as we heal and also seek to thrive and have our young people thrive in the context of the pandemic. So we're going to just share a few slides, some illustrations. On the next slide, there's an illustration of comprehensive school mental health systems, which is the term that's often used to describe what you see here, which is a multi-tiered system of support. So these types of systems essentially reflect partnerships between education and behavioral health or mental health sectors to support a full continuum, or what schools often call a multi-tiered system of supports. And that goes all the way from promotion, mental health promotion for all, to treatment. We know that some states and communities have really well-established school mental health systems and others have less infrastructure. And essentially what you see from the multi-tiered system is that for all systems of support in schools, there really needs to be a foundational element of school family community partnerships and a healthy and well-trained professional workforce, including our educators and our mental health specialists and other school staff, to support the well-being of young people in schools. And then in a multi-tiered system, we have a layering of support. So essentially at tier 1, you've got universal supports for mental health, just like you would universal supports for academic things like reading or for math. You have what's in place for everybody. And in the mental health space, that would include things like mental health literacy in the curriculum. It would include things like social emotional learning and competency development. And then we layer on at tiers 2 and 3 more intensive supports for students who may be struggling with mental health challenges. And that can look like brief group interventions or individual interventions, or even more intensive mental health treatments. And on the next slide, we show you that one of the reasons that we've moved into tier 2 and tier 3 supports in schools is because although schools have always been and likely will always be considered a place to support mental health and social emotional well-being for all students, in the last few decades, it's really increasingly being recognized as an essential place to provide mental health, individual and group and family interventions for those who are struggling. And part of the reason for that you can see here from the data reflected, is that youth are far more likely to initiate and to complete mental health treatment when it's offered in schools as compared to some of our other types of community mental health treatment settings, like outpatient mental health care, for example. On the next slide, we want to draw your attention to what Elaine mentioned in the introduction, which is the first ever National School Mental Health Report Card. It was just released a couple of weeks ago. On the next slide, you'll see who generated these report cards. It essentially was a pulling together by a national partnership of several organizations, that many of whom you likely recognize. They're all there really supporting the health and well-being of young people across the nation. And together they recognize that schools and school mental health are absolutely essential, especially during this global pandemic and moving forward from it. So we just want to highlight a couple of the main features of these report cards. On the next slide, you'll see that essentially there's a state-by-state snapshot of all 50 states and the District of Columbia to understand how they measure up with respect to 8 key policy areas to advance school mental health system quality. And although you can't see it too clearly here, we used a pencil rating system here. So essentially, the states are looked at in terms of 1, 2, or 3 pencils. How much are they actually implementing these areas of quality policy? So things like, to what degree are they meeting the standards for school mental health professionals to students in their schools? To what degree do they have policies in place that foster meaningful school, family, and community partnerships? To what degree do they have funding in place to support comprehensive school mental health? Are they doing well-being checks or mental health screening to identify when students are struggling, and to what degree they're connected to and feeling that they belong in their school setting? So each of the states has its own report card, and it highlights both the areas of strength and also some areas for improvement. On the next slide, you can see another point within this report is that we highlight some of the pace setters, what we call policy pace setters. So we know across the country that diverse states are making significant strides in adopting policy changes that will better support student mental health in each of those report card policy areas that I mentioned. And for each of those, we highlight one or more states that stand out for their efforts. And those are what we call the pace setters. And we hope that they'll essentially provide some inspiration to enhance school mental health policies in other states. So for example, I know you're going to be hearing from a leader in the Michigan Department of Education shortly. And in the section on funding, it's noted that many states have taken the important action of expanding their school Medicaid programs to cover all Medicaid enrolled students and to allow Medicaid billing from licensed social workers, psychologists, psychiatrists, and others who provide mental health services in schools, including via telehealth. But Michigan is highlighted as a pace setter because it's taken that one step further by including certified school psychologists and licensed school social workers as Medicaid billable providers. On the next slide, we just wanted to note that the report cards go through all of the different policy areas as a snapshot within the states, but we also drill down into each of these areas. So in this case, you can see here the ratio of school mental health professionals to students in each state is highlighted, including those states that are outperforming standards and those who have progress to make. And in some areas, you'll see that there's quite a bit of progress to be made, for example, in the area of school social workers to students with respect to ratios. So we hope and anticipate and have already seen action as a result of some of these report cards, and hope that they serve as a starting point for policymakers who want to strengthen school mental health supports and policies in their communities. Thanks so much for having me, and I look forward to the conversation.
Thank you, Sharon. That was a wonderful summary, and I think we're all just grateful that you and your center are offering such helpful advice, guidance, and TA to states and to the schools to help them quickly develop their mental health services, because as we know, that's where the children are, and that's where we need to get the services quickly. So thanks again for that. I now will introduce Scott Hutchins, who comes to us from the great state of Michigan, where he's an innovative leader in the Michigan public school system. Scott served as a principal in the Jackson Public Schools for 15 years and as a principal in the Marshall Public Schools for 4 years. And prior to that, he was an elementary school teacher. Currently, Scott is the Mental Health and Medicaid Coordinator for the Michigan Department of Education. And I would note that Sharon just gave Michigan a high mark as a pace setter for the work that they're doing in the report card. So we know Scott's doing a great job. Scott is directing and overseeing efforts to coordinate Medicaid and mental health services in public schools across the state of Michigan. And under Scott's leadership, the state is making incredible progress, and we are delighted that he is here today to share his experience with all of us. So welcome, Scott.
Thank you so much, Elaine, and thank you to First Focus. Really appreciate the opportunity to be here. And I want to start off by, before I get into what we're doing in Michigan, I want to thank Dr. Hoover and her team for that amazing report card. That was definitely an opportunity for us in Michigan to look at it as a growing and learning opportunity. I know that when it initially came out, some people were thinking that it was, if they didn't score as well as they would have liked to, they looked at it as, something that was frowned upon or whatever. And we in Michigan were actually just the opposite. We were excited for the feedback. It was nice to see some positive kudos, which we appreciate the acknowledgement, but we also knew that we needed areas to improve in. And so we were very grateful for the time and effort that it took to put that resource together. And as I said, it means a lot to us in Michigan and is helpful to the work that we're doing. We were fortunate that just over 4 years ago, our legislators started responding to the school violence that was taking place across our country in America. The first conversations in Michigan were around hardening schools. How do we, reinforce entrances to schools? How do we make sure that a bad person can't come into a school and do a bad thing? And so that's where the conversation started. And eventually the legislators and the governor's office came together and really talked about, no, let's actually address the problem and try to figure out, how do we help our students that are hurting themselves and hurting others by addressing their mental health needs? And so we're very fortunate. This was obviously prior to the COVID pandemic. This was prior to all the political and social unrest that we've all felt across the country. And they really made a significant investment in Michigan on mental health, which we're very fortunate. With that said, we started building this system support for children with only around $30 million. or roughly $20 per student. Now, again, we were grateful for this funding, but as you can imagine, that's a pretty minor investment to begin with. However, once that funding was added to our State School Aid Act in fiscal year 2019, we also, as Sharon mentioned, looked at expanding our Medicaid program. That was so those two significant events for Michigan really is what launched our efforts to create this mental health system. So we amended our Medicaid state plan and expanded our coverage to include reimbursement for all Medicaid eligible students receiving behavioral health and support services. Many states just have that coverage for their students with an individualized education program or an individualized family service plan. But we were one of, I believe, 16 states that expanded our Medicaid program to include all of our eligible students. And that expansion is called Caring for Students. As you can see from this slide, I've got just a few things that I wanted to kind of point out. And again, we mentioned the Medicaid expansion, and we mentioned that money that came in through the legislators. And that money that came in directly to schools started with an investment in allowing us to hire mental health professionals directly in schools. So as Dr. Hoover mentioned, being able to add school psychologists, school social workers, other mental health professionals that could provide mental health services or eligible services to students. And because we expanded our Medicaid program, we're able to get reimbursement for that. But that started with that significant investment from our legislators of that $30 million I talked about. So we have in Michigan what's called intermediate school districts, which are a consortium of districts by county. Basically, we have 56 intermediate school districts or ISDs in Michigan, and that funding went directly to them, which allowed them to hire those behavioral health providers. And again, as I mentioned, not only the money to hire the providers, but by expanding our Medicaid plan, they could also recoup reimbursement for those services, which is looking at a longer term sustainable model. So if that funding happens to change, we can at least rely back on our Medicaid reimbursement. So in these pictures, you can see it's a combination of our Medicaid expansion, it's a combination of that money flowing to our intermediate school districts. That legislation, which was so significant, allowed our providers to start actually addressing the needs of our students. If you go to the next slide for me, please. So in addition to that funding for the behavioral health providers that I talked about nearly 4 years ago, we've continued to expand that funding. So this year, for example, in our State School Aid Act, we have both sections 31N and 31O, which this year the allocation was nearly $300 million. So I mentioned before we started with a budget of only 30. This year it was over $300 million, and it expanded the funding to not just intermediate school districts, but also local districts to hire behavioral health professionals. Now, that funding has resulted in over 1,400 helping professionals across our state. Again, we're extremely grateful for that. However, just like the rest of the country, we're facing the same issues that others are in terms of having enough providers to fill the need. So even though we have a significant amount of money from our legislators, we don't have enough providers to meet the significant needs of our children and staff in schools. So we are still working on how do we expand our talent pipeline. So we're working with our labor and economic opportunity in our State Department on a process called talent pipeline management to find a long-term solution that would encourage individuals to become behavioral health professionals. In addition, as you can see on this staff here, we are using technology to connect students to services more efficiently. We were able to obtain a care platform, virtual care platform from MD Logics called BH Works. You can see the intent of this is to simplify the process for providing comprehensive behavioral health services. It's allowing us to improve confidential communication with families, school staff, and providers, and have access to that real-time data, which is very significant. Finally, on the next slide, I want to talk to you a little bit about where we're heading next with Michigan. As I mentioned, the report card to us was very influential. It allowed us to see what we were doing well, but it also showed us where our areas for growth are. As you can see here, the first thing I want to mention is the training. We're looking to fund something called the Behavioral Health Learning Collaborative of Michigan, or an online community of practice that will offer on-demand mental health training for all school staff and stakeholders, where they can take that training on their time We also want to expand our needs assessment and resource mapping across Michigan. That's the next visual. So finding out what all the resources are within each county, so that if it's not a school-based provider, it's a community provider or a hospital, child adolescent health center, etc. We want them to be working together. The third image is universal screening. Our governor has actually, in her proposed budget for next fiscal year, proposed $25 million to expand universal screening in Michigan. We need to be able to create an infrastructure so that we're able to do that efficiently and effectively. We don't just want to screen students for the sake of screening them. We need to get them connected to services. And then finally, that last visual there is a medical report. We are working with Centers for Medicare and Medicaid on a project to expand our community partners and our school health-based providers so that they can actually exchange student health information. So just like us as adults, when we go to the doctor's office or we take our children, we can sign off on permissions to share our dentist talking to our primary care physician. Right now, we have that disconnect where school-based providers can't do that. We're looking to expand that project. So in closing, I just want to say that we have a long ways to go, but we're excited about where we're at with Michigan. We love to partner or collaborate with any other states that have similar ideas like ourselves. And again, I want to close by thanking Dr. Hoover and her team for that amazing report card, which is only going to help us in Michigan. Thank you.
I'm going to unmute myself this time. Scott, thank you so much. It's incredibly helpful for us to see and to sort of get an illustrated example of what some of the work looks like on the ground and in a state to expand and increase mental health services in schools. So thank you for your work. It's just a pleasure to learn about the ins and outs of what you're doing in Michigan and all the great improvements you've made so far. We're now going to start our question portion of the program. Again, anyone watching can add a question in the comment section if they'd like to. And I'm first going to start with a question for all four of our panelists, and I'll just run through the order in which everyone presented. The first question we'd like to ask all of you, because we have largely a federally focused audience, is what do you think one or a couple of the top actions that Congress and the federal government can take to improve youth mental health? It's a pretty broad question, but I think a lot of our viewers want to know what can be done at the federal level to that will help improve what's going on the ground and in states and localities and school districts. So Trace, we'll start with you. What do you think Congress and the federal government need to be doing here?
Yeah, this is a wonderful question. I would first like to again stress that the peer-to-peer support model can be so impactful for teens across the country. We know that Youthline works, and we would really love to expand our reach so that all young people in the United States have the option of talking with another trained teen when support is needed. And Congress should look for ways to integrate kind of that peer-to-peer aspect with the new 988 line, and also providing funding for states to develop similar programming. But I think if there's anything I really want to leave Capitol Hill with today, it's this. Teens are talking, and we need you to listen. We know that young people are mobilizing like never before, and we really need Congress to invite those youth to the table. And while there are many ways we can really do that, I think it starts by ensuring that young people can meaningfully contribute to and be involved with legislative work on the local, state, and federal level.
Thanks, Trace. Really appreciate that. We'll go to Miriam next. Oops.
Thank you, Avery. That it's such a great question. I think about it sort of really kind of in two parts. I mean, I think we have to the point of, like some of my other panelists have raised, workforce comes up, as a huge priority here. I mean, I think we absolutely have to understand and be prepared for the reality that there could be, dollars, whether through Medicaid or other, federal funding streams or investment states are making to be able to expand or finance like the cost of delivering mental health services, and there won't be the workforce in place to actually make that a reality in terms of delivering services to babies, toddlers, and families. And so I think really looking at the the very targeted strategies and investments we can make at the federal level to really look at the mental health kind of workforce needs. I'm thinking about, again, a workforce as well that reflects the diversity of the children and families is absolutely critical. I think looking at the agenda that we have in response to this pandemic and coming out stronger from this. So access to home visiting, paid leave policies, quality childcare, the child tax credit, these continue to be important prevention and mental health promotion strategies that work for babies. And then I'd say finally, securing America's Future Act reauthorization.
Thanks, Miriam. Thanks for drawing some of the connections between some of the programs that First Focus and others viewing also support in the broad space of children and their families. We'll go to Sharon next.
Sure. Yeah, so I think about it, I often think about the work we do in two buckets, kind of promotion, prevention, and then intervention for those who may be struggling with mental health concerns. So some things that we would wish for Congress to support include in that first bucket of promotion prevention, really providing guidance or suggestions for the requirement of indicators of student health and mental health and well-being as a core metric of school performance under federal education funding, with provisions to assist schools as they strive to perform better. And that may include things like school climate or student-reported subjective well-being and distress. It could include things like incentivizing teacher education programs to include mental health literacy as a part of their required pre-service training. And then finally, establishing mental health as possibly a state required component of K through 12 curricula, which will help our young people not only identify how they can best achieve positive mental health, but also seek help for themselves, for their peers, for their family when they need it. The second bucket is that intervention piece. And one of the most important things that can be done now is to support student mental health by encouraging all states to cover all medically necessary mental health services, including prevention services for all Medicaid enrolled students, and by ensuring that Medicaid programs have updated guidance, best practices, and technical assistance that they need.
Thanks, Sharon. Scott?
I think my amazing co-presenters said it perfectly. The only thing I would add is just like you're seeing with us right here, you've got Youth Voice covered, you've got 0 to 3, you've got Dr. Hoover who can see the whole picture, you've got myself at state level. I think the importance of having the legislators bring as many people to the table as possible to look at a collective solution to mental health. So again, not just, there's going to be so many people that are going to be pulling for funding, but if we can come together as a group and say, okay, investing in loan forgiveness programs or investing in a talent pipeline management so that we have behavioral health providers that can address the needs of 0 to 3, address the needs of high school students. As Dr. Hoover talked about, creating that K-12 mental health curriculum. So I think the most important thing is to bring as many people to the table as possible so that we're not competing for each other's resources, but rather we're working together to come up with one comprehensive mental health package in our schools.
Thank you, Scott. Elaine?
Yeah, all right. We're going to go down the line and just ask a couple questions of each of you. So let me start with Trace. Trace, what do you think schools can do to address the stigma of mental health regarding students?
Yeah, thank you for the question. I think the first step in addressing stigma is acknowledging that it exists, right? Having resources versus having teens actually access those resources are two completely different things. And we really need to work on bridging that gap. We can talk about project funding and new initiatives all day, but it really doesn't matter at the end if we don't change the perception of mental health from its core. And I think schools can really play a role in that by creating a comprehensive and standardized mental health curriculum across all ages. Just like the work of 0 to 3, right? We need to talk about mental health from birth. Starting in elementary, we should be normalizing emotional vocabulary, conflict resolution, and teaching about appropriate resources when children don't feel safe, right? Just as how we teach them to go to the doctors when they don't feel well. In middle and high school, all students should learn about engaging in real world help seeking behaviors, developing those systems of self care that are so important later in life, and also supporting our friends with mental health struggles, because statistics again show that we turn to each other before anyone else. I think Youthline's mental health curriculum has been especially popular in Oregon because we extend the peer-to-peer model into classrooms, meaning that teens teach other teens about mental health. That in and of itself, I think, is so impactful, and it really helps destigmatize those conversations, just using people who are already doing it, right? Like teens are already talking about this issue. I can assure you that talking about suicide or anything like that isn't a new struggle for what teens are already doing. So if anyone is interested, we would love to connect later and share some more. But thank you.
Thanks, Trace. That was an incredible answer. And just proving over and over again why the youth voice is so important to have here. Thank you. Miriam, I'm going to turn to you next. Trace answered a question about stigma, which I think relates to, as you mentioned in your opening remarks, to the early childhood arena. And I think you're right in that some people may not know what you're talking about when you talk about infant and toddler mental health, or believe that that's actually something that's needed. Can you illustrate for us a little bit more, just to paint the picture of what kinds of supports you think parents, caregivers, their children need at those ages in order to identify and then to treat any mental health challenges they're facing?
Yeah, absolutely. So, I think we really need families, and with babies and toddlers are interacting with a variety of systems. So I mentioned some of that, our child care providers, caregivers, often two systems where, a child may, a child and family may interact when there is some kind of concern about stress in the family, will be, or a concern about development, could be early intervention, the child welfare system. These, the pediatric primary care system, we know the healthcare system is, primary system. When we think about where are families showing up, these all need to be the kinds of systems with professionals that feel that are grounded in an understanding of infant early childhood mental health, and they have to be able to, and see themselves as having a role in supporting that. So I think that's just absolutely, how do we better support all of the professionals, people working in these systems that are interacting. So this multidisciplinary approach, and say this isn't an expertise that is siloed in one system when it gets to a level of a more serious cause for concern, right? I think that's absolutely fundamental. I think we need to also be able to speak directly to families, and be able to create more spaces and opportunities for families to have a voice, to be able to talk about, we've all been through something really tremendous and hard over these last 2 years. And I think it's critical that we look at, is COVID again opening up this dialogue to be able to talk about isolation, lack of connection, different stressors, and normalizing that, and give parents the kind of tools, ability to be able to ask these questions, have curiosity about changes in behaviors that they're seeing, and feel less of that stigma around it. So I think those are two really important things, and just all grounded in, this is something real that happens to babies, especially in light of what we've been through. And we can all do a better job of thinking about how to recognize those signs, and how to be knowledgeable, more knowledgeable about how to connect families to those right kinds of services and supports.
Great. A question came in, Sharon, that I think might be good for you, from the audience. It's the question is, I am an occupational therapist in Michigan in the schools, and I think our role in mental health is often overlooked. However, it fails under our scope of practice. especially in the schools within the MTSS model. I think there are many occupational therapists who have mental health training that could help address the shortage of mental health practitioners. Has this ever been considered?
It sure has, and I very much appreciate the question. We have actually, at the National Center for School Mental Health, long worked with the American Occupational Therapy Association. They are a longstanding member of our advisory board, and we agree. Occupational therapists, in addition to some of the other professionals that we've mentioned, our school psychologists, school social workers, school counselors, school nurses, and other health professionals, are all critical. We talk about every adult in the school building, and even more so every peer now in the school building, as Trace talked about. Everybody plays a role in mental health, but I would agree that occupational therapists are often not thought of immediately as part of that essential workforce, and they do have critical training in mental health, so should and can be a part of this solution.
Thank you.
Thanks, Sharon, and thanks to our audience member who submitted that question. I really appreciate it. Scott, I've got a question for you. You mentioned this a little bit, you hit on this a bit, but the collaboration between school mental health services and a student's other medical providers, can you talk a little bit more about how you're able to encourage that in Michigan? We sometimes hear concerns that HIPAA and FERPA, these federal laws, don't allow for that kind of communication, but would love to hear a little bit more about how in Michigan you're overcoming that and allowing that to happen.
Yeah, great question. Thank you. So first off, there is a requirement with Medicaid that in the school services program that if services are being, for example, if a student is receiving a plan of care at the school level, that there is coordination with that primary care provider. So that's a critical piece. Now, what that looks like across the board is much different. I mean, sometimes it could be just an email to a primary care provider that says, hey, I'm working with this child who's under your care and we're developing a plan of care. Others send a US letter. So that is something that we're continuing to work on. As I mentioned before, that project that we are looking at that's funded by the Centers for Medicaid and Medicare is one of our partners is MyHIN, or our Michigan Health Information Network. And we are trying to figure out, as I mentioned before, how do we get our school-based providers more connected to the primary care physicians? So right now there's that requirement in a Medicaid plan of care that you have coordination so that you're not duplicating services. But we want more than just a generic requirement that says services have to be coordinated. We'd like to streamline that process by getting them connected through what's called the My Gateway or Michigan Gateway, where they can actually exchange those electronic health records. Perfect example would be if you got a primary care physician who's treating a student with prediabetes. That same student, because of the prediabetes, perhaps maybe they're overweight, is coming to school, not feeling good about themselves, having depression, anxiety. If we can get that primary care physician and that school social worker to talk about those things together so that they're co-treating the prediabetes or the weight management that's necessary along with that child's anxiety and depression, that's what we're trying to do, is close that gap. We're a long ways from that, but that is certainly a goal that we want to work on here in Michigan. And we do know about the HIPAA and FERPA difference, and obviously that needs to be worked out as well, for sure.
Thanks, Scott. I can't believe we're almost out of time already. We just want to give our panelists one more quick opportunity to leave us with any final thoughts they've got, and we'll go in order, again, starting with Trace, in order of the presentations.
Yeah, thank you. I would just like to say thank you again for tuning in to listen to this really important conversation. And if you would like to connect later, please reach out to the Youthline website. It was posted in the link, but we can post it again, and be on the lookout for an email.
Just really echo Trey's. I thank you for including the perspective of babies in this really important discussion, and just really have learned so much from so many of the panelists and the other presenters here today. And we'll definitely make some more resources available as part of follow-up. But yeah, thank you so much, and thanks to this great panel.
Thank you so much as well. And the one point I just want to put in there, workforce has been brought up a fair amount, and there's been a lot of investment at the federal level into the health and behavioral health provider workforce with respect to burnout and well-being. And I would say I hope that we'll see similar investments in terms of educator well-being, because if we're trying to take care of the student mental health in our schools, we also have to take care of all the adults around them, and perhaps most importantly, our families and our educators. So thanks again.
My final comment would just be, you're not alone in this work. So again, very appreciative of Dr. Hoover and the report card. Use that as a reflection, use that as a learning opportunity, see where you're at, see where your state is at, and find what you're doing well and what you're not, and then reach out to folks like myself in Michigan, Dr. Hoover, or Trace, who's got that amazing student line that's available across the country, not just in his state in Oregon. There are wonderful things that are happening. And even if you're one person out there wondering where you start by asking for help. Reach out to us, reach out to our amazing advocates here at First Focus on Children. They're here to support. There's plenty of resources that are out there. Dr. Hoover referred to the Advancing Comprehensive School Mental Health Systems. But again, you don't have to do all of that work yourself. People have already started it. So feel free to reach out to any of us that can support your cause, because really this is about getting the care of our students met, getting their needs met. And as Dr. Hoover mentioned, also taking care of our adults as well is critical. So thank you again very much.
All right. Well, it's always important to say thank you when people spend so much time and effort preparing. So thank you to our amazing panelists, your expertise, your experience, your thoughts. It was very valuable to us, and I feel like we're just beginning a conversation. I want to say thank you to Senator Smith, for opening up the briefing today. We really appreciate her support. I want to say a quick thank you to Olivia Gomez, Tim Smith, Haley Winter, and Michelle Kale. They're on our First Focus team, and they really helped put this briefing together today. And a final thank you to everyone who joined the briefing. You've spent an hour of your time. We hope it was valuable, and you'll go back and do good advocacy work. I just want you to know that for those who registered and attended, you'll receive a summary of the briefing, the slide decks, any links to our resources that our expert panelists put in the chat, and a link to the recording, when we will post all of that to our website as well. And finally, if you have any questions, please feel free to reach out to Avery or myself. And thank you, and have a great day.